COVID-19 prevention and control in Kashgar region as of October 26th. We have carried out nucleic acid tests across all the close contacts of the asymptomatic cases. And our local health authority has taken stringent measures in order to put the situation under control. $610,000 people have been swabbed for nucleic acid tests in the region. All counties and towns in the region almost all the population in the region has been swabbed. As of 16th o'clock in the afternoon of October 26th, more cases are being under test. 4.74 million people have been swabbed. And 2.13 million people have got their testing results. We are going to do all what we can to support the testing process to ensure all those who need tests are going to be tested. Since February this year, we have carried out a lot of efforts to launch an early warning system in order to carry out nucleic acid tests in the earliest time. This is an important step in the prevention and control of the COVID-19 cases. And the first asymptomatic case over these days has been detected in our regular tests. The first asymptomatic case was reported on the 24th of October. And as of the 25th of October, we have carried out a testing across a large number of people. From the angle of prevention and control, the measures have been very effective. The asymptomatic cases have been detected at a timely manner and put into quarantine for medical observation. The fast response has helped with cutting the spread channel of the virus and has laid a solid foundation for further prevention and control of COVID-19. And we have carried out nucleic acid testing at a very timely manner. And we have received a medical team, expert team from the central government to help with detect the source of the virus. And all measures for prevention and control have been put into place. Thank you all. I'd like to thank the spokesperson for giving the latest updates on the nucleic acid tests in the Kashgar region. I'd like to give the floor to the Deputy Secretary of the Shufu County to give you more information. Dear members from the press, please allow me to give you some information on the prevention and control of COVID-19 cases in Shufu County. Since the outbreak of the COVID-19 cases in our region, in our county, we have followed the centralized deployment of our region, and under the guidance of our region and the government, we have taken targeted measures for prevention and control of the epidemic. And the Central Guidance Department has decided that as of October 25th, the Shufu County four counties in our county will be classified as high-risk towns, areas. And other regions will be classified as medium risk and low risk areas. And we have received strong support from the expert team from the central government. And we have dispatched an epidemiological research team who has carried out research over the asymptomatic cases and close contacts in order to cut the spread of the spreading channel of the coronavirus. And we intend to cut the spread as fast as possible so that we can gain an upper hand over the coronavirus. Now we have detected 164 asymptomatic cases in our county. And according to epidemiological research, these results are highly similar to the coronavirus symptoms. And we also carried out close research on their contact with wild animals and whether they have fever and cough and other symptoms. According to our nucleic acid testing capacity for the moment, we are doing our utmost to cover as wide range of people as possible to ensure targeted and accurate testing of the people in the region. And we are trying to follow the regulations accurately and strictly so that all measures are put into place. And we are carrying out trainings over the staff in order to prevent cross-infection. Another measure is to strengthen the management of the fever clinics department. They are at the front line of the prevention and control of the epidemic. So their safety is very critical to the prevention and control. We're taking more measures to strengthen the management of the fever clinics. For those patients who go to the fever clinics, they will be required to take nucleic acid tests. For those are more suspected, they will be prioritized for the tests. During the testing, the people will be asked about their epidemiological history and other symptoms. And for those in hospital and their people who are at their company, they will be also asked to take nucleic acid tests. Another step is to carry out disinfection. For the key areas and places, we will carry out the disinfection, including the medical institutions, the interior of the cars, and other places. We will carry out disinfection twice or 3 times a day. Thank you. I'd like to thank you for your information, for the information on the Shufu County in preventing and controlling the situation. Now, I'd like to give the floor to another speaker to give you information on the material supply in the Kashgar region. Dear members of the press, now I'd like to give you some information on the material supply in the Kashgar region during the prevention and control period. We have put in place a material supply guarantee mechanism to ensure enough people are ready for help. We have dispatched professional staff to ensure grain supply and other material supply. For those places with a large number of people, we will carry out key quarantine and inspection, and we will ensure that these places will be disinfected. And the agricultural composite market, those markets in the Kashgar region, their inventory has reached 2,926 tons. Garlic price and the price of other commodities have been kept stable. And there are 8,600 tons of product grains. And this is to ensure that the food supply in the region will be met. And also, we are keen to meet the meat supply in the region. And also, we will ensure that the disinfection products and the sanitary products will be supplied in the region. We will do all what we can to ensure that the daily necessities, needs of the people will be met. And we will also offer our hand to those in need and provide daily necessities to the poor families. We will also provide more medical supplies, including the disinfection supplies, to ensure the production, transportation, and the storage of the medical supplies and emergency supplies will be met. As of October 25th, 40 medical institutions in medical factories in the Kashgar region are operating at their full capacity. And also, we are trying to keep the market price stable. And we have talked to the local authority to carry out a stronger testing to ensure the price is stable. Thank you. I'd like to thank the spokesperson for the update on the material supply in the Kashgar region. Dear members from the press, ladies and gentlemen, the Information Office of the People's Government of Xinjiang Uygur Autonomous Region have given you the latest updates on the epidemic control in the Kashgar region. This is the second press briefing of its series. Thank you all for watching.